Thank you for your interest in the Oculofacial Plastic and Orbital Surgery Fellowship Program at UCI Gavin Herbert Eye Institute. This is a 2-year program fully accredited by the American Society of Ophthalmic, Plastic, and Reconstructive Surgery. We're one of about 25 or 26 programs in the odd year cycle. Odd year means that the fellow starts and finishes on odd calendar years. I thought I'd start with sharing a population density map of the United States, and this shows that Southern California is really one of the highest densities of individuals. And this really drives the high surgical volume and depth and diversity of pathology. We are the only academic ophthalmology center in Orange County, and while there are many providers in greater LA as well as other eye institutes, there are really not much cross-penetration of patients. Our catchment area is largely Orange County, Inland Empire, including Riverside, all the way to the desert. Interestingly, there's not much overlap due to traffic patterns. Patients generally don't like to get on the highways. So even though it's a short geographic distance, the time in the car to travel to LA is really prohibitive. So patients generally stay in our Orange County zone. Down south, we capture patients all the way to North San Diego. We have some referrals off coast from Hawaii as well as around the country for specialty-specific services. The fellowship covers several sites. The two affiliated with UCI include Gavin Herbert Eye Institute, which is in the city of Irvine on the UCI undergrad college campus. And this is next to Newport Beach, which is known as one of the cosmetic surgery capitals of the country, if not the world. UCI Medical Center is in the city of Orange. This is closer to Anaheim and really close to Disneyland, in fact. The fellow also covers VA Long Beach as well as Kaiser Harbor City. I'll describe these in further detail. So UCI Medical Center is a level 1 trauma center where we see the full gamut of trauma as well as other acute care. On this campus, we also have an eye center, an eye clinic. We share a building with ENT, and this clinic really functions as sort of the all-encompassing, everything through the door type of facility. Orange County does not have a dedicated county system, but UCI Medical Center sort of doubles as not only the academic center, but also the county system for the region. And so on Tuesday, we have a fellow and as well as a referral clinic in Pavilion 2, where we see all sorts of patients, including patients with limited access to healthcare. But we also see referrals and sort of the really academic and high pathology tertiary care types of referrals. The VA Long Beach is one of the core sites for the fellow. The fellow rotates there every Monday and has a full FTE. The fellow is the primary oculofacial provider at this site, and while one of the ASOPers preceptors, Dr. Edri Rickrema, covers the site as well, it's really a hands-off approach. Dr. E is there just to back up the fellow. Dr. E is also neurotrained and covers a large share of the neuro-ophthalmology clinics at the VA, but is also there to back up the fellow. But it's a really, again, a hands-off approach where the fellow is the primary provider and only calls upon Dr. E as needed. On Wednesdays, the fellow spends an operating room day with Ken Feldman at the Kaiser South Bay site. Kaiser, for those of you not aware, is one of the largest healthcare systems in California. In the Southern California Orange County district, they have something like 4.5 million subscribers. And within oculoplastics, Ken Feldman is the senior main orbital specialist. And so even though they have other oculoplastic providers within their system, they very regularly refer the more complex orbital cases to Ken. So Wednesdays are really a funnel of really high complexity academic type cases where the fellow participates directly. Gavin Herbert Eye Institute is perhaps the academic hub of the department as well as the fellowship program. We have lectures and conferences here. The third floor is all dedicated academic space with lecture halls and conference rooms. There's obviously also heavy clinic space and procedure rooms. The G level has operating rooms. We have 2 operating rooms on that level. On Friday, our main operating room day, we very frequently run 2 rooms, so we see a high number of patients. The Institute also has a full basic science division, and fellows in the past have participated in basic science research divisions. The research division is growing very fast. Recently, we cracked the top 10 in NIH funding. Again, so if there's any interest in basic science research, the fellows have ample opportunities. The faculty, including myself, as I mentioned earlier, include Ken Feldman and Lilangi Eriwikrema. Other ASOPers, preceptors include John Park, who is in private practice but maintains privileges through UCI Medical Center. Through Kaiser System, there's another Ken Krantz, who is based out of the Orange County Irvine office. And Ken sees the full spectrum of oculoplastic, but he also is part of a really growing skull-based team through Kaiser. And so there's a lot of interesting pathology that come through there. Other faculty that are part-time include Jeff Joseph, a former fellow of our program who is in private practice. He comes on site to supervise the fellow clinic once a month. Steve Yolen is an ophthalmologist who is considered one of the pioneers of facial injectables as well as neurotoxins. He is a general ophthalmologist who, interestingly, exclusively performs injectables. Does really no other ophthalmology or other oculoplastic surgery. And we have really close collaborations with our dermatology department. Chris Zachary, the former chair, Patrick Lee, and Melissa Shaw perform high-volume Mohs surgery. And they are also really focused on lasers. Chris Zachary is one of the pioneers in many of the different laser platforms, and they have ample opportunities for the fellow to learn about these. Dermatology, in fact, is going to move into our eye institute in the next year or 2, so our collaborations will actually grow. Some of the faculty in the program have unique additional training beyond their ASOPers training. John Park is ASOPers trained at the Mayo University of Minnesota combined program, but he did an additional general plastic surgery residency, and his practice is full body cosmetics, so there are opportunities for the fellow to work with him and learn body cosmetics and below the neck procedures. Lilangi Eriwikrema is also neuro-ophthalmology trained prior to her ASOPers training at UC San Diego. Interestingly, the faculty, the main 5 ASOPers faculty are all of different training backgrounds. We come from different parts of this ASOPers family tree, and it really creates a diversity of approaches to different or even the same types of problems. And it really, I think it lends itself to a really robust experience for the fellow. The basic structure of the program is truly an apprenticeship junior attending sort of role. We have primary surgeon and primary provider roles at all sites. We do, have other assist roles, but these are interspersed with the primary surgeon responsibilities. The case mix, like most oculoplastic practices, is heavily weighted towards eyelid and periocular, but we also have one of the largest orbit and skull-based experiences here. Naturally, we have lacrimal and socket procedures as well. Cosmetic surgery is quite high here just due to the population. The Newport Beach, Southern California area is considered one of the higher penetration cosmetic surgery areas around the country. So not only do we perform a lot of facial cosmetic surgery, we have a huge part of our practice dedicated to revisions of complications of cosmetic surgery. Lid retraction and lag ophthalmos are certainly things that we are treating routinely in the practice and in the fellowship here. The general philosophy of the program is surgical competence through really diverse and high volume experiences. Ken Feldman and I, the 2 senior faculty, generally emphasize a mastery of orbital surgery. We believe these are sort of the hardest aspects of the field to gain proficiency in. And we think these are the building blocks for doing anything else. A lot of the other periocular and even eyelid surgery comes a little easier than the orbital surgery. So we really focus on educating the fellow on deep orbital surgery and skull-based surgery. We also emphasize scholarly activity. We not only have the fellow participate in all ASOPers meetings, but other academic enrichment activities are not only encouraged but sort of mandated throughout the year. We have cadaver labs locally as well as in different parts of the country. We also not only encourage but expect a lot of productivity in terms of academic writing, peer-reviewed papers, number one, but we also are constantly contributing book chapters and other pieces to other academic enrichment sources. So some of the highlights of the program here are really the balance of autonomy with supervision. They're really fellow-run clinics and operating rooms at all sites, the VA and UCI. The fellow has a primary surgeon responsibility at all sites. Surgery is practically every day of the week. Monday, Wednesday, Thursday, and Friday are all OR days, and we treat the full gamut of orbit, eyelid, lacrimal, and facial cosmetic surgery. We have diverse faculty, as I mentioned, from different training backgrounds, and really lends itself to getting exposed to different solutions to different problems. We have abundant research opportunities, including basic science opportunities. And our fellows have really had top job placements over the years. We have several in high-profile academic opportunities, as well as private practice. Lastly, OC is a great place to live. We have beaches. We have great weather year-round. We have major activities, so there's really no shortage of things to do. And the faculty are all generally easygoing and fun, and we all value the fellowship as one of the highlights of our week and our careers. And so thank you for taking the time to learn about our fellowship program, and please contact us directly if you have any additional questions.